Hello viewers. Talking of cardiac arrhythmias simply put are cardiac rhythm disorders. Which means to say that we have a normal electrical circuit in our heart which regulates our rhythm and maintains it in a certain range or zone based on our biological or metabolic needs. Now, when we have cardiac arrhythmias, we develop some pathologic or functional abnormalities in that electrical circuit, either because of primarily electrical problems or because of some structural problems in the heart, like massive heart attacks or cardiomyopathies, heart failure, birth defects as kids are born with holes in the heart, or a host of other structural problems, which can lead to secondary cardiac arrhythmias. And these cardiac arrhythmias can cause debilitating or very resistant, stubborn, niggling symptoms to the patients, and many of them can be actually life threatening. All of us are aware about what we mean by angioplasty, angiography. These are all catheter based procedure where the catheters are passed into the heart through blood vessels. Many of our viewers must be abreast to those techniques. Now, electrophysiology catheters are also very similar catheters. I am demonstrating an electrophysiology catheter for your benefit. Now, if you notice, these are flexible soft catheters, and these catheters are passed largely from the groin of the patients under local anesthesia, just as angiogram is done using those catheters. Now, once inside this heart, if you notice at the tip of this catheter, there are electrodes, and you can see these minor electrodes, small, very sophisticated small electrodes. And actually, once inside, these catheters are very soft and flexible, and notice there is a little movement of these catheters, and these catheters can be twisted and rotated inside the heart. And these electrodes allow us to record electrical signals from inside the heart and display in large monitors. So using these catheters, like I just demonstrated, we can touch each and every corner of the heart, all the chambers, and we can go to the chamber of interest where the arrhythmia is arising from, and can create beautiful electrical maps that I would just demonstrate to you, and thereby precisely and accurately delineate and demonstrate the critical arrhythmia circuits which are causing the fundamental problem. Now, once these arrhythmia circuits are identified and precisely determined, it's easy for us to target them using the same procedure. Maybe the next step of the procedure is called catheter ablation, where we use another catheter of similar type and just ablate or give some thermal energies inside or on those critical circuits, which help us treat these cardiac arrhythmias. So, like I said, these catheters help us generate these kind of maps. Now, this is how the cardiac chambers look. So, these are two illustrations for you to show how we can create geometry of the heart and find out the detailed electrical activity of these cardiac chambers, which represent the cardiac arrhythmias, whereby we can eliminate these arrhythmias by delivering radio frequency or catheter ablation therapy. So to summarize, electrophysiology procedures and catheter ablation is a great tool with a very rapidly advancing technology, which helps us control or eliminate majority of the cardiac arrhythmias which can be life-threatening or compromise patients' quality of life by doing a very simple and patient-friendly vascular procedure where we enter the heart using these catheters, and we understand the electrical activity and the arrhythmia circuits in great detail using such catheters, and are able to deliver such remarkable results, which I am proud of. Like, Apollo has given us that platform to use state-of-the-art equipment, modern equipment, which is just fresh with this technology, and I'm glad that we've been able to deliver some great results. And we're always at your disposal. Please feel free to get in touch with us for any of such issues, for that matter, any cardiac problems, where we're 24/7, we are there at your service and your disposal. Thank you, and please take care of your health and have a great Diwali. Thank you.